Good morning, everyone. My name is Pranav, and my partners and I, Shail and Yash, will be presenting on cardiovascular benefits of exercise, which are many. This leads us right into our next slide. So cardiovascular strength. First of all, cardiovascular strength directly correlates with cardiovascular disease. That means that if you have more fitness, you are at a lower chance of risk for cardiovascular disease. This also goes hand in hand in life expectancy. There's a 41% increase in life expectancy for athletes with high cardiovascular fitness rather than average athlete. And this is shown in a French cyclist versus French regular men. This also directly, again, correlates with athlete's heart. Athlete's heart is basically, it's shown that athletes have a bigger heart than more people. It's called hypertrophy, which basically means that there's a bigger heart in athletes and pumps more efficient blood than normal people. Then this is cardiac remodeling. Cardiac remodeling is basically with higher cardiac fitness, means thicker cell walls, and your heart will basically remodel itself in order to meet the supply of blood being pumped into various organs faster, and this is cardiac remodeling. Next, we have how the heart is determined physiologically. This means that, as you can see in the picture to the right, you see that the thickness of walls of a athlete is bigger, and it's again more thicker. There's more end diastolic volume for the left ventricle and right ventricle, and more stroke volume, while a normal heart is just normal. And again, on the other side of the spectrum, we have a pathological heart, which means it's a diseased heart, and it's just smaller walls and just looks much more faint and less healthy. Thank you. And next, my group members will be presenting the rest of the article.
These diagrams on the right discussed intensity-controlled treadmill running exercises performed by the rats and how it induced cardiac myogenesis and angiogenesis. In picture A small newly formed Burden cardiomyocyte is shown from a high-intensity exercise animal. In picture B, the percent number of Burden cardiomyocytes formed was dependent on both exercise duration and intensity. Picture C shows a newly formed Burden capillary of a high-intensity exercise animal. Picture D shows that just like the cardiomyocytes, capillary density of exercise animals was also dependent on exercise intensity. This set of diagrams talks about the activation and proliferation of c-kit endogenous cardiac stem and progenitor cells in the heart of exercising animals. In picture A, you can see the c-kit and ECSC number of control and following 2 to 4 weeks of high-intensity training. In picture B, you can see the ECSC of a high-intensity exercise-trained animal.
Cardiovascular exercise has been proven to improve endothelial function in individuals with coronary heart disease, ultimately improving vascular relaxation along with immune function. Studies have also indicated that high-intensity exercise is associated with enlarged diameter and vasodilation of arteries. Shear stress during exercise is also important for the regulation of endothelial tissue and vascular tissue function. The benefits of cardiovascular exercise are most evident in athletes who have arteries with large lumen and normal endothelial function. While intensity, duration, and frequency of exercise should be considered important, the total volume of exercise, or the amount of activity or work being performed, should be considered first and foremost to prevent negative cardiovascular health outcomes. When considering intensity, the vast majority of evidence indicates that exercise 4 times a week, 45 minutes per session, is ideal to optimize cardiovascular health.